Mr. Arruda.
In English?
Yes, in English about Dr. Nomer. So Quebec's screening strategy is being criticized both by Canada's chief scientific advisor and Mrs. Nomer and various experts in Quebec. They say that the strategy should include randomly testing people with no symptoms to get an accurate read on how the virus is spreading and identifying areas before they become outbreaks. How do you respond to that criticism?
First of all, I understand that people have some criticism, but people only have one part of the data. They are not aware of what quantity we have. We are using, I would say, the tests the best way we can use them at a different prices. If I had an unlimited testing capacity, even you here would have been tested, you know. But we have to choose. At the same time, they are looking at this strategy based on their vision, on their specific situation. But we have to balance with the care of the persons. We know that we have a high level of positivity, which is 16%, meaning that the tests we use, we are using in the right place. Before going to, I would say, random sampling in the population, we have other priorities, like asymptomatic contacts of cases in intensive situations. So I think I can receive it, but we have a plan. We have discussed it with experts. We are adapting from data what we have in here. And so it's easy to say this criticism, it's okay. But they have only one part of the diagnosis, and it's why we will try to explain. And even everybody has an idea. Everybody seems to have the right answer. And I always told good scientists have doubts. I have doubts. I'm going to adapt. What I'm saying today will be different tomorrow. But it's easy to say that way. And I think that I will have to explain to Quebecers and to my boss what is the strategy, but not really for the ones who are talking from what is their perception.
Question for Premier Legault. I was reading Alec Castonguay's long story about your handling of the COVID crisis, and there's more. In the last few weeks, there's been more criticism of the way Quebec has handled the crisis. There's been changes of the messages, 60 and then 70, that debate that we had yesterday. How do you evaluate your management of the crisis? Is your game plan still working?
Okay. First, it's not to myself to evaluate me. Second, we were one of the first place in North America closing schools, closing some regions. So I think we act very rapidly. Now, of course, the situation is different today than it was 2 months ago. And the rules that we've put in place permit us to open a bit to older people. And I think it's normal, and Dr. Arruda explained it very well. It's normal that the situation evaluate because we have to balance the problems we create with the problems we get from the COVID-19. Of course, when you have somebody of 65 years old being at home for the last 2 months, the situation is different than 2 months ago. And we have to balance mental health problem with physical risk that are associated with seeing other people. But now we know more than 2 months ago what it means to be at 2 meters, at 6 feet of the other people. So because we've putting that in place, because we're telling people to have a mask if they get too close to other people, it permits us to have different rules today. But of course, it's changing fast. and the population is trying to understand, and I can understand that sometimes they are not sure that they understand, but it's our job to be here about every day. We were here 5 days a week. Now it's at least 3 days a week. And we're trying to explain, and I'm trying, and I did my best. Was I perfect? Probably not, but I'm doing my best.